What are the reference interval for plasma glucose? Basically, as I mentioned, we do two tests. The first test is fasting blood sugar and the second test is post glucose blood sugar. For fasting blood sugar, the patient comes with at least 6 to 8 hours of fasting and the blood is drawn and the blood glucose is measured. Anything less than 100 is considered normal and anything more than 126 on the repeated occasions is considered diabetic. This repeated occasions is extremely important. A single reading of 126 does not necessarily indicate diabetes. So this intermediate level of 100 to 126 is the borderline zone of impaired glucose tolerance, which does not indicate that the patient is diabetic, and at the same time it also indicates that the patient is not normal. So patients who have history of diabetes, who have who are overweight and who show the reading between 100 to 126 may be able to revert to normal if they are able to control their weight. As far as post glucose blood sugar is concerned, the patient is given to drink 75 grams of glucose and after 2 hours the blood glucose is measured. In normal patients, the levels will be less than 140 milligram percent, and in diabetics, the level will be more than 200. This level of 140 to 200, which is the intermediate level, is called as impaired glucose tolerance, and this is where borderline patients will fit. In case the patient is able to control his weight, in case the patient is able to do exercise, patients with impaired glucose tolerance can become normal. Previously, many years back, there was a test called a GTC, glucose tolerance curve, where 5 to 6 samples of blood were collected after giving 75 milligrams of glucose. This test is no longer used in the diagnosis of diabetes. Which are the tests that are done to know whether a diabetic patient is in control or not? For this, we have plasma glucose. Plasma glucose may be done 7 times a day in a hospital setting. However, in the OPD setting, this is not always possible. So, for most patients, we do a fasting and a postprandial blood glucose. What is postprandial? It means that a patient takes his meals, knows the time when he has finished the meal, and after 2 hours gives his blood sample. When I say 2 hours, it doesn't mean that you have to put a stopwatch. It can be plus minus 15 minutes, which should not really affect the result. Many times in Bombay, patient starts from his home and takes some time to come to the lab. Sometimes a patient gets delayed. So if a patient has had his meal at 12 o'clock, I'm supposed to collect blood glucose at 2 o'clock. However, if the patient gets delayed and comes half an hour late or maybe 1 hour late, and he still insists that he wants me to measure his blood glucose, then it has to be remembered that as the time passes, the levels will keep dropping. So if the level at 2 o'clock at the end of 2 hours was 200, after half an hour it may come 170. There is no hard and fast rule how much the sugar will decrease as time passes, but it has to be remembered that in case there is a delay in testing, then the sugar levels can drop. Routine testing should be done when the patient is not sick. As we all know, infections tend to increase the requirement of insulin. So a patient who is normally under good control may go out of control in the presence of infection. Testing should not be done for a period of 7 to 10 days. Testing should be done whenever the patient has been on a routine meals and routine medicines for at least 7 to 10 days. So in case you have gone out of your city, in case you have been traveling, you have not been able to follow your routine regimen, you are now irregular with your medicines. Immediately after this period, it is not advisable to do fasting post lunch. It will not give idea whether you are in control or not. It is better that you get stabilized, follow your routine for at least 7 to 10 days before you go to the lab to test whether you are in control or out of control. One common mistake that patients do is on the day of testing they omit the medicine. Please remember the medicines are short acting. They have the effect only for a couple of hours. So if you are a diabetic and if you are on medicines and when you come for testing of fasting and post lunch blood glucose, The idea is not to diagnose diabetes. The idea is to see if the medicines that were given to you have been effective in controlling your blood glucose. That is why it is extremely important that patients take medicines on the day of testing. What are the target levels of therapy? Whenever a diabetic patient is put on anti-diabetic agents, we aim for a fasting glucose of 90 to 100 and a post-lunch measurement of not more than 140 milligrams. It has to be remembered that hypoglycemia can be more dangerous than hyperglycemia. Many times patients tend to measure glucose at home. This is most useful in patients who are on insulin. However, patients who are not on insulin, increased frequency of measuring glucose at home has been not been very helpful for the control of diabetes. What are the causes of variation in sugar levels in diabetic patients? This can be because of stress, infection, exercise, a change in diet, or a change in dose or the type of insulin. The most important being infection. Whenever a patient of diabetes gets infection, a patient who was normally under control will go out of control. In case you are exercising regularly and you stop exercise, you will realize that your sugar levels are rising. During the season of April and May in Mumbai, a lot of patients tend to eat a lot of mangoes. Because of this increased intake of sugar, the levels will increase. Sometimes the type of insulin, the amount of dose that you take will also matter, and this will result in out of control states in the patients who are normally under control. We get a lot of questions when we see reports. So common question is the fasting sugar is 200 but urine sugar is nil, and post meals it is 126 and urine sugar is 2%. It has to be remembered that urine sugar does not always tally with blood sugar, and in diabetic patients urine sugar is not really useful to know whether the patient is in control or not. So in case you are a diabetic, it is recommended that you may omit the measurement of urine sugar because it will not help you to tell you whether you are in control or not. Sometimes we get very high levels. Patient relative may come and ask me, the patient's sugar is 600 milligram percent. How is this possible? The patient is still walking around. Please note that high blood glucose level will not necessarily produce clinical side effects. So we can have patients with sugar of 600 and 800 who will be walking around. As I mentioned, hypoglycemia is more dangerous than hyperglycemia. So when the sugar level goes down, that is the time that you have to be more careful and you have to keep a watch. Let us look at the other common questions that are asked. I have a patient whose fasting sugar is 102 and a post lunch comes to 90. The question asked is, how can fasting be more than post lunch? It is not necessary that the post lunch sugar has to be more than fasting. This is because, as I mentioned to you, as the glucose in the food is digested and the blood sugar levels start rising, the pancreas will secrete insulin, and this insulin will take away the blood glucose from the blood and put it in the liver in the form of glycogen. So because of the insulin effect, the post lunch sugar can be less than fasting. Many times patients who are diabetics are often on anti-diabetic agents. What is normally done is that they are giving a tablet which they are supposed to take before or after meals. This tablet will cause increase in levels of insulin, and that is why in diabetic patients who are on tablets we find that many times the post lunch blood glucose is much lower than the fasting sugar. We also have a case in which the fasting sugar may be 80 milligram percent and a blood glucose may come 60 milligram percent. Patient asks that in spite of taking so much glucose, how did the glucose level drop? Again the answer is that because of excessive glucose in consumption, a paradoxical increase in insulin will produce hypoglycemia. What is glycosylated hemoglobin? Glycosylated hemoglobin is a new test that has just come into vogue in the past 8 to 10 years. RBCs normally live in the blood for 120 days after they are produced. RBCs contain hemoglobin, whose function is to carry oxygen. Once the RBCs are formed, the hemoglobin compound in the RBCs gets slowly but irreversibly attached to plasma glucose to form glycosylated hemoglobin. This association is irreversible and it continues at a rate which is dependent upon the blood glucose level. So when we measure glycosylated hemoglobin, or which is also called as HbA1c, it measures the it is a measure of the glucose level for the last 120 days. So when we measure glycosylated hemoglobin in a diabetic or in a normal person, we get an average of the last 3 months of his blood glucose. The reference values for glycosylated hemoglobin are for in healthy adults up to 6%. In diabetics, if it is up to 7%, we can say that the control is very good. It can also be used for the diagnosis of diabetes. So for a patient whose history we do not know, who has never got tested himself previously, who is not able to come to the lab for fasting or post glucose measurements but can come only during the middle of the day, we can take a random sample without any dietary restrictions for glycosylated hemoglobin, and if the level is less than 6.5, we can say he is not a diabetic. If it is more than 6.5, we will have to say that he may be a diabetic. We can also derive the mean plasma glucose from this formula. So if the HbA1c or the glycosylated hemoglobin is 6%, his mean plasma glucose will be 132. If it is 6.5%, it will be 150, and if it is 7%, it will be 167. So in diabetics, what we try to do is that we try to see that the level gets maintained around 7 or 167 milligram percent. Not all instruments that do glycosylated hemoglobin are equal. We have to use NGSP certified methods which have a CV of less than 3%. That is, only those methods which are accurate and consistent should be used for the measurement of glycosylated hemoglobin. Many times we get a result where the glycosylated hemoglobin is 12% and the plasma sugar is only 90. Is this possible? It is definitely possible. What happens is that let's presume we have a patient who has never been diagnosed with diabetes. He gets diagnosed as a new patient, starts treatment. After 1 month, he comes back for testing. At that time, the plasma sugar will be normal. However, glycosylated hemoglobin, which is a measure of last 3 months of average 3 months of glucose, will still come high because in the previous 3 months his blood glucose were high.